Good evening, Melrose. This is Mayor Paul Brodeur. Today's Department of Public Health weekly COVID-19 statistics for Melrose show that our positivity rate has grown slightly from 2.73% to 2.4%, and our number of positive cases per 100,000 rests at 19.2. Some great news: Melrose is making great progress getting folks vaccinated. 31% of Melrosians have been fully vaccinated, and 51% of us have had at least one dose. Now, as you probably know by now, as of April 12th, approximately 6.85 million doses of the Johnson & Johnson vaccine have been administered in the United States. However, distribution of J&J is on hold while the CDC and the FDA are reviewing data involving 6 U.S. cases of a rare type of blood clot in individuals after receiving the J&J COVID-19 vaccine. All 6 cases occurred between women aged 18 to 48 years of age, and the interval from the receipt of the vaccine to symptom onset ranged from 6 to 13 days. So here is some advice from the Massachusetts Department of Public Health to kind of guide yourself if you have in fact received this vaccine. If you have received the J&J COVID-19 vaccine and developed severe headache, abdominal pain, leg pain, or shortness of breath within 3 weeks after vaccination, contact your healthcare provider or seek medical care. 2, report adverse events, including those symptoms described above, within 3 weeks of vaccination following the receipt of any COVID-19 vaccine to your healthcare provider. And finally, if you are scheduled to receive the J&J vaccine, if you haven't heard already, please contact your healthcare provider, vaccination location, or clinic to learn about additional vaccine availability. Now, please note that Moderna and Pfizer continue to be available, and I am happy to report that I had no ill effects whatsoever from my first Pfizer dose, and I'm anxiously awaiting my second. Please get the vaccine as soon as you are able. And another reminder: testing, testing, testing. Testing is an important part of the overall strategy to contain this virus and its variants, even if you're asymptomatic. It's quick, free, easy, with no wait at sites as close as the Saugus Square One Mall. And if your child is a student in the Melrose Public Schools, please take advantage of the free pooled testing that takes place at your child's school. Now, finally, don't forget the basics. I know you're tired of hearing this, but please don't forget these basics. Wash your hands, wear a mask, maintain social distance, always cooperate with social tracers, stay home if you're sick, and again, get vaccinated as soon as you can. With the existence of these new variants and increased spread in some segments of the population, we still need to use every tool at our disposal to protect public health. If we do, together we will get through this. Thank you and have a good evening.